5, the last thing that your doctor should have told you when you were initially diagnosed as being a type 2 diabetic is that medications don't work. Definitely get a lot of pushback with this one, but I'm ready for the smoke and I'm with the shits. So you have to understand that there's been multiple studies when it comes to type 2 diabetes, but also high blood pressure. VDAT, V-A-D-T, Accord. We're talking about studies that have shown people being compliant to medications, and other studies that have been regulating their glucose very tightly, so tight diabetes management. We have studies that show that you can take the medications, you can be as compliant as you want to be, and you can be as aggressive as you want to be with the medications as far as keeping blood sugar in a tight range. The overall outcome as pertains to the complications, which are blindness, kidney disease leading to dialysis, stiffening of the arteries, which leads to strokes, high blood pressure, heart attack, neuropathy, gangrene, amputations, all of those things. You can be as strict as you want to, but it does not take you out of the race to leading down that road of complications when it comes to diabetes. Why? Because the medications don't do anything for the foundational reason you are diabetic. The medications does not stop you from eating processed foods. The medications will not stop you from drinking sugary drinks. The medications will not make you get up and start walking or exercising. The medications will not stop you from eating around the clock. They don't do that. And that is the reason you are a type 2 diabetic. The medications give you a symbolic victory. The medications will make you feel good while dying inside. The medications will cause your doctor to give you a high five while you are suffering and silently dealing with erectile dysfunction and PCOS. All while these folks are showing that, hey, your labs are looking good. Your A1C is where it needs to be. Now, did you gain 50 pounds from the insulin that we gave you? Yeah, lose weight. Did you have to go to the hospital because your blood sugar went too low because of the sulfonylurea we gave you? Yeah, but you know, that's part of the game. But look at your numbers, they're normal. So your numbers are showing a normal value or an improved value. But what is your true value as pertains to health? You feel like crap, or you're tired of taking all the medications. You're tired of being limited, and you're tired of depending on the medications themselves. These medications will not take you out of the race of dealing with the complications that people who are non-medicated but still living that same lifestyle are at risk of. So the person not taking any medications but still living the processed food lifestyle is on the same path, or you are on the same path as the person who is taking the medications but has not made the changes to your food, your drinks, your movement, your fasting. If you don't make those changes, both of you are heading down the same road. The only thing is that you're unaware, or you're pretending to be unaware. You're allowed to pretend to be unaware. The person who is not taking the medications, they know what they're doing. They know that they're at risk. They see it when they check their blood sugar. They see it when they look at their watch. All the signs and symptoms are there. They're constantly waking up at night to go pee. They see the dark lines on their neck. They're missing menstrual cycles. They're dealing with erectile dysfunction. They're dealing with the gynecomastia. They're dealing with the lack of energy. They're dealing with the blurriness of the vision. They're dealing with all of those things. They are very much aware that what they're doing as far as their lifestyle is causing these problems to happen. On the other side, that person can continue to do the same thing. But as far as their awareness, they're now allowed. They've been approved to ignore the complications or ignore the issues or pretend that they're not happening because you're taking the medications where when we check your finger stick, it looks good. When we check your A1C, it looks good. You're doing better. The blurry vision, we might just have to send you to an ophthalmologist, but everything looks good. The high insulin level is still causing stiffening of your arteries. Your blood pressure is only looking normal because you're taking the medication. Your blood sugar is only looking normal because you're taking the medication. And the medications will eventually get to the point where it's not enough. And what's going to happen? They're going to add on more medications. And so the medication that's being used to help out with your diabetes will now start to increase your cholesterol, and you're going to start to take muscle medications for that. And that medication will now start to cause muscle pain, and you will have to start taking medications for that. And then that medication will cause erectile dysfunction, and you will have to take medication for that. And that medication is going to cause your blood pressure to even go up even higher. You have to take and so it becomes this perpetual cycle of medications on top of medications. And you get to a point where you have no idea anymore what's really going on. You have no idea what's really true. You don't know, because there's so many different hands in the pot that we've created a situation where nothing makes sense anymore. We're just taking medications. We have a whole tackle box of medications, and nothing makes sense anymore as far as why it's going on and what I need to do about it. That is what that journey will take you. It's going to take you down that road, and it's also going to cause frustration because you may still experience a lot of the symptoms and a lot of the signs and a lot of the comorbidities that people who are not taking medications. You may find yourself still becoming sicker. You may find yourself with a lower immunity. You may still find yourself gaining a lot of weight. You may still find yourself, unfortunately having a heart attack. All the things that you were trying to prevent are still on the table, even though you're taking medication, because the medications will not deal with the core reason for you being diabetic. I hope you understand that. I hope you understand that. And this is the conversation that someone should have had with you when you were diagnosed with type 2 diabetes, because the things that come behind being a type 2 diabetic are life-changing. And so a good, hard, solid 30-minute talk or 15-minute talk or something where, look, this is what comes with type 2 diabetes. If you want to go down that road, then keep doing what you're doing. If you don't want to go down that road, then here's what I recommend. You as an adult, you have to now make the decision. Yo, what's going on? This is Edward, and you have just watched a clip from my YouTube channel. If you want to see the full video, be sure to click the link in the description to watch the full video on my YouTube channel. Peace.